Okay, welcome to our series of videos about, this one is about shoulder examination. I'm going to run through an examination that I typically use for middle-aged to older patients. So the conditions often are different depending on the age group. For example, the conditions that we're thinking about here are shoulder arthritis, subacromial bursitis or impingement, frozen shoulder, rotator cuff tears, AC joint arthritis and biceps tendonitis. So we'll go through each step and what each of them mean. So start with inspection, so look, feel, move. So start with inspection, see if there's any slings, and then also have a look at the patient. So from the front, there's no scarring, wasting, swelling, nothing. Face that way. So again, from the side, it's really good here looking at wasting of the trapezius and also the supraspinatus fossa, so for supraspinatus tendon, and face the wall there for me. So again, here it's quite good at looking at periscapular muscles, infra and supraspinatus. Okay, Lee, face back towards me. So what we'll do now is feel. So again, it's about sequence and systems. So the two things that I'm really feeling for are AC joint pain and subacromial pain. So work from medial to lateral, so clavicle, and just yell out what you're doing. AC joint, any tenderness there?
No.
Come across to the acromion, so subacromial space just below, any tenderness?
No.
And then the scapular spine. And then move. So this is the money here. So let's start with active range of motion. So abduction, copy me. All the way up. So you're looking for symmetry. So this actually gives you a lot of information right from the get-go, right? So if he's got full range of motion, then he doesn't have severe arthritis, he doesn't have frozen shoulder, he doesn't have a massive cuff tear. So now you're thinking it's impingement, it's AC joint, it's biceps. So during that movement, was there any pain? So painful arc means that there's an arc where it's painful to abduct through. So it's around about 90 degrees. So it's about 60 to sort of 100 degrees of movement. And then if he has pain at the end of movement, that may indicate an AC joint pathology. Okay, if he didn't have full active range, this is where it's good to try and work out where is the range coming from. And in all of those shoulder conditions, the range is usually just from the scapula only. So then there's no movement from the glenohumeral, or minimal movement from the glenohumeral joint. You can tease that out by looking at his back. So just face the wall, we'll have a look at your back, and then just do the same motion. So here you can see the scapula moving out. And so if you need to tease that out further, come down there. You can fix the scapula by doing this. We're testing this shoulder. So fix the scapula by doing this and do the same movement. So you can see that his scapula is not moving. And so normally you only have 90 degrees of glenohumeral range. So that's good. So for example, if he had arthritis, he may do this only. And then when he's going up, then it's only his scapula. So you'll see patients in the clinic say, okay, up you go, and they'll go like this. Because it's all coming from the scapula, none of it is coming from the glenohumeral joint. So that's abduction. Next is external rotation. So Lee, face me, copy me. So elbows tucked in and copy me. So here you're looking at external rotation. Again, this is active range. So if they block out there, then, so from here is actually very informative. So before, if they had a stiff shoulder, if they couldn't go up, then you're thinking arthritis, you're thinking frozen shoulder, and you're thinking massive cuff tear. So in frozen shoulder and arthritis, they'll similarly have limited range of motion and external rotation. Cuff tear, they also may have limited range of motion, but they will have active, passive range. So you can push them further and then see if they have a lag. So pretend that Lee only had external rotation to there, then I would say just relax and see if I can move it further. So if I couldn't, then it's probably either severely arthritic or frozen shoulder. But if I could, and he had a lag, so when I let go, he bounces back, then that might be a cuff tear. And if you have normal range, then it's either normal, or he's got subacromial bursitis, or he's got AC joint pathology, or biceps, or a combination. Next is internal rotation movement, range. So what you do is you say, Lee, can you put your hand behind your back? And you're looking for which level of your spine as a guesstimate. So thoracic, lower thoracic, upper lumbar, lateral, buttock, or lateral thigh. So that's all your range of motion. Now you go to special tests. So you start with supraspinatus. So the way to do supraspinatus is you do Job's test, where you put your arm in abduction or forward flexion in the plane of the scapula, so 30 degrees forward. Just copy me, and then put your thumb down. Okay, so by putting your thumb down, the deltoid turns in, so you're theoretically testing supraspinatus. So just hold it there, keep it there, don't even move it. So hold. So by doing both at the same time, you get a lot of information. So that one is supraspinatus. Next one is infraspinatus, so that's external rotation. So I'll get you to, so we practice, so he knows. So I get you to hold it there, keep it there, and I like to put my thumb and my ring finger over his wrist and control the axis of his forearm with my index and middle finger. That way I can feel, so I'll say, hold it there, keep it there, don't let me move it. Ready? So I can feel how much of this is abduction and how much of this, is abduction and how much of this is external rotation. Remember, we're just testing external rotation. If that's difficult or you want to be a bit more precise, what you can do is you can external rotate past neutral, and that tends to give you a better isolated test, but doing them both at the same time is a bit faster. So then you external rotate out as far as they go. So hold it there, keep it there, and you're testing external rotation there. So that's, again, infraspinatus. Next is subscapularis. So you can do push-off test. I tend to do belly press because a lot of people with shoulder problems can't get their hand behind their back, so everyone can do this. So again, just let me take your hand. So hand on your belly, and then make sure that the elbow is facing forward. So that's to help prevent a false negative by them adducting instead of internal rotating. All right. So hold your hand on your belly and don't let me move it. Ready? Okay. I might just test it the other way so that people can see. Okay. Hold your hand on your belly. Don't let me move it. Ready? That's good. Yeah, that's good. So that's 5 on 5. So we've done look, feel, move. We've done active and passive range of motion. We've done rotator cuff strength. Now it's the other special tests. So the first thing to test is impingement. So again, with our abduction, you may have had a painful arc. So now you're already thinking maybe this is going to be impingement positive. The impingement test, there's two. One is called Hawkins test. So just relax your hand for me. So that's with the arm in forward flexion, elbow in flexion. And what we're trying to do is we're trying to bring the greater tuberosity onto the acromion. So just relax for me. So if it's positive, it will be sore. And again, so that's Hawkins test. The next test is called Neer's test. Again, the idea is the same. You're trying to bring the greatest tuberosity, which is the most prominent, onto the acromion. What you do is you internally rotate the arm, so thumb pointing down. You fix the scapula with your hand, and then you forward flex until it hits. And at some point, they may say it's painful. So those are the two impingement tests. Next is AC joint. So again, in your field, you may have felt some tenderness on AC joint. And what this is a passive test, so it's called crossbody test. So say, Lee, put your hand on your other shoulder. Yep, and just relax for me. Let me push your elbow. Relax. So here you're stressing the AC joint, and if it's tender, and you can put your finger over the AC joint. If it's tender, then that's again a positive AC joint sign. And last is biceps or long-headed biceps. So I tend to use Jurgensen's, and biceps does flexion and supination of the wrist. So that's the position you put them in. You say, hold it there, keep it there, don't move it. In the meantime, I've got my finger over the bicipital groove. Okay, hold it there, keep it there, don't move it. Ready? And I'm pronating, and he's supinating against me. And if that's tender on my finger, then that's a positive sign. The other test you can do is speeds test. So what that is you put your hand up in the air. Some people do it at 30, some people at 90. I don't think it matters either way. And just hold it there, keep it there, don't even move it. And those are the two tests for long-headed biceps. Thank you very much. We'll see you in the next video.